Hi, good morning. My name is Sri Devi. I'm from Ernakulam. I'm stays here with my family. And about my professional life, I completed graduation and post-graduation in biotechnology, and I worked as a biotechnologist and tissue culturist, and I worked as a medical coder also till 2016. After that, I started my career in 2017. I started my career as a full-time home tutor, and in between for 1 year I worked as a medical coding tutor. Now I'm working in Angle Beeler as a full-time home tutor. Okay, that's about me, and I want to take a class on blood circulation. Okay, this topic may be familiar for you, maybe you studied the things, but we have to uh, study the blood circulation very importantly, because it's something not that much easy as we think. Okay, so while we considering the blood circulation, we have to consider main three components are heart, blood vessels and blood. Okay, the main organ is what? Heart, blood vessels and blood. Okay, every organ have its crucial role. uh, in case of heart, it is very important because in a human fetus the first organ is developing is heart, and it works till our death. Okay, so 24-hour 365 days it's working for years till our last breath. So it's very important organ. And while we considering the body of heart, we have to understand the position. The position is not exactly left, it is almost or exactly at the middle of chest, but the bottom portion of heart is deviated toward the left side. That's why doctors putting the stethoscope on the left side. That's why they can hear the beat very clearly, because the bottom portion, okay, this bottom portion clear is doing the pumping action very clearly. This is the actual picture of heart position. Okay, and heart is protected behind the ribs, and the you know that ribs are attached to a sternum, like this. Like this, the ribs are attached to sternum. Okay, ribs are attached to sternum. Behind this sternum and rib, the heart is located. Okay, and which is the organ who is near to heart? That is, yes, lungs. Okay, lungs and heart located near, so that they can exchange the oxygenated blood very fastly. Okay, and while we studying the structure, first we have to study the chambers. Heart have 4 chambers, like this. This is right side and this is left side. This you should always remember. This is the pictures, right side and left side. This is atrium. The upper portion is always atrium, and the lower portion is ventricle. This is the this is right ventricle and this is left ventricle. Upper portion is atrium and the lower portion is ventricle. And not only in case of humans, every mammals have this 4 chamber. The crocodiles have the 4 chamber, and avians, means birds, have the 4 chamber. Almost all the vertebrates possess 4 chamber hearts. Okay, and in these chambers, in between these chambers, there are valves. Valves are for which purpose? For the control of flow. Whatever the fluid is flowing, they have to control the flow, otherwise the pressure will increase. Okay, so the in between the right atrium and right ventricle, there is which valve is located? Here it is tricuspid valve. Tri means 3. Here I attached a picture so you can understand it better. this is the tricuspid valve. Here you can see 3 slit. Okay, that's why it's called tricuspid valve. And in between the left atrium and left ventricle there is a bicuspid valve. That bi means 2. That means only 2 slits are there. Like this is not actually 1 slit, this is actually 2 slit like this, but it's looked like one, and actually it's not like that. It's a bicuspid or mitral valve. Bicuspid or mitral valve. These are the valves. And from the right ventricle, what's starting? The pulmonary artery is starting. Pulmonary artery starting from the right ventricle. At the base there is a valve. This area have a valve. It is called pulmonary valve. And from the left ventricle, what is starting? Aorta is starting. Here also at the base there is a valve. It is called aortic valve. These are the 4 main valves in case of heart chamber. Not only heart, majority organs have valves, especially our digestive system have valves, but we think that only hearts have valves. Not like that actually. Okay. And next is about the wall. We know that heart have muscles. That's why it is it's bouncing, means it's beating full day or full lifespan. It is beating because of heart, because of heart muscles. Okay, so here you can see the names of the 4 layers, that is pericardium. Okay, pericardium, epicardium, myocardium, endocardium. In these 4 names you can see a common word, cardium. What do you mean by cardium? Do you have an idea? Cardium. Cardium, what is the name of doctor who is dealing with the heart patients? Yes, cardiac surgeon, means cardiac doctor. So cardiac means, cardia means heart. Okay, so peri means outermost. So in this picture you can see pericardium have 4 layers. It's not a single layer actually, it's 4 layer. Altogether collectively it is called serous pericardium or pericardium. Okay, and the names are visceral pericardium, pericardial cavity, parietal pericardium, fibrous pericardium. Okay, and inside that what is located? Epicardium. So first pericardium, then epicardium, and the next is what? Myocardium. What do you mean by myo? Myo means muscle. Okay, so here you can see the myocardium is comparatively big. Okay, so it's a big sheet or a layer. It contains lot of muscle cells. Okay, and the innermost layer is called endocardium. What do you mean by endo? Endo means inner, very inner. That is called endo. Okay, so the names are pericardium, epicardium, myocardium and endocardium. These are the layers. So now we talked about the chambers, the valves and the layers. Okay, next is the function. Heart have lots of functions. The main function is, yes, pumping of blood. Heart is the pumping station of blood, that we know. Okay, so what they are doing, they pumping blood to arteries, and it reaches the targeted organs, and veins collect the deoxygenated blood. In between the arteries and veins, what are the connectors? Capillaries. Okay, in the coming slides you can understand that from the picture. And the second is delivering oxygen. I already mentioned that lungs and heart located very close, that so that they can exchange oxygen very fastly. So that's why the blood is delivering oxygen to the targeted cells with the help of heart. And the delivering of nutrients from the digestive system. There are a lot of uh, arteries are connecting to the main blood vessels, so they can absorb the nutrients from this digestive system to the targeted cells. So the nutrients are properly delivered at the targeted area, so targeted cells. The third is removing of waste materials, waste products. What are the waste products normally? You just think, what are the normal waste products? Not after digestion. Our cell in our body, lots of cells are there. Every single cell doing some chemical reactions. So the waste will be there. Yes, carbon dioxide is the main waste product, and other chemicals are there. Okay, so the waste products are removed from the cells and they are uh, forwarded to the targeted areas. What are the targeted areas? Normally excretory organs like kidney, lungs, skin. Okay, through the kidney the urine is expelling, and through the skin the sweat is expelling out, and through the nostrils carbon dioxide is expelling out. So the properly they are replacing, or they are transporting from one place to another only with the help of blood. Okay, so these are the second points. And blood pressure, I already told that this area, this ventricle area, these are the lower area, this ventricle area doing what? Push. Because of that push, blood is moving through. Here you can see blood is moving through the pulmonary artery and aorta. Not pulmonary artery. Yes, pulmonary artery and aorta. Okay, so the pushing speed is high. Not pushing speed, the force actually. The pushing force is high in this area. That's why blood is forwarding, means they are in a forwarded direction. Okay, so while that pressure will give a trigger to the blood to go in a forwarded direction. And I already mentioned that these areas have what? Valves. For what purpose the valves are located there? To stop the backflow. Okay, to stop the backflow, that valves are located there. Okay, so these are things happening, and because of that pumping a pressure is created, that because of that pressure the blood is moving in a forwarded direction. And also while blood is moving through the vessels means through the arteries, through the veins and capillaries, blood giving a pressure to the walls of these vessels, and also the vessels giving a pressure to blood. So altogether this pressure is called blood pressure. Okay, so that blood pressure is maintaining very clearly or very accurately because of the proper pumping of blood, proper pumping of heart. And next is heart rate. What is the heart rate of a normal human being? Yes, 60 to 100 per minute. So the heart rate is controlled, it have a rhythm, it have a speed, only it is maintained because of the proper beating of heart. Okay, and the next is immune mechanism. We know that humans, all the mammals have well developed immune system, and this immune system is working properly only because of the help of blood, because the white blood cells, uh, the RBC, the platelets, all are uh, roaming in the blood as a as invigilators, especially in case of platelets and white blood cells. They are the proper invigilators of the immune system. They finding the antigens and they kill in that uh, area, at the spot. Okay, so the immune system have a very the immune system is working properly only because of the blood and the associated blood cells. Okay, especially WBC, the white blood cells. So immune system is working only because of the proper flowing of blood. Okay, next we should know about the blood composition. Okay, blood composition. Blood have, I will write it clearly, two parts, fluid part and cell part. This fluid part, this is actually fluid part. This is actually fluid part. It is called plasma. Plasma. And the cell part, it is called it is included RBC, WBC and platelet. RBC, WBC and platelets. Okay, so plasma, that is actually not water, it is fluid. It has a light sticky kind of character. While we have any cut or small cuts or wounds on our finger, first a few seconds or a few minutes the blood will flow. After wiping that blood, you can feel a sticky kind of thing is coming or oozing out from the wounded side. It's not have a color. Sometimes you can see a pale yellow color or a hair color you can see. Actually that is plasma, otherwise it is called serum. Okay, that is actually plasma. It is 55 percentage. While we taking blood, the 55 percentage is plasma, means the fluid part, and the remaining uh, is almost 45 percentage is cells. What are the cells? Red blood cells, white blood cells and platelets. Okay, and you know what is the required volume of blood for an adult? Yes, it's 5 liter. That means 7 to 8 percentage of total body weight. Okay, so while we telling about the the blood composition, we have to say that red blood cells are otherwise called erythrocytes. Why? Because red blood cells are red color. Erythro means red and cyte means cells. Okay, erythrocytes means red cells, red colored cells, and white blood cells means they have no color, white color, and platelets, they also have no color. Okay, I attached a picture. That's I think you can. Okay, there is no picture. Okay, these are erythrocytes or red blood cells, white blood cells, platelets and plasma, that already I mentioned. And what about the red blood cells? I want to add few points. I don't want to go for a descriptive session. Okay, red blood cells, they are mainly for what? I already mentioned that blood carries oxygen. Why? Because blood have RBC. RBC is red color, but they carry oxygen. How? Because RBC have a protein that is called hemoglobin. Hemoglobin. Heme. What do you mean by heme? Heme. You heard that name? Heme. Heme means iron. Okay, heme means iron. Fe, iron. And globin is a protein. Globin is a protein. Okay, so iron and protein join together a structure called hemoglobin. Okay, this hemoglobin like this, Fe, this hemoglobin structure, not actually Fe, it is hemoglobin. This hemoglobin can carry 4 oxygen. Okay, this hemoglobin carry 4 oxygen molecules. These are the oxygen molecule. These are the oxygen molecules. So they can carry 4 oxygen molecule at a time. Okay, so that's why we called that blood is carrying oxygen very well only because of that hemoglobin protein, and that hemoglobin can carry 4 oxygen molecule at a time. Okay, and where is this red blood cells are produced? They are produced in the bone marrow. Okay, and here I used some terms like deoxygenated and oxygenated. Oxygenated means oxygen are binding to red blood cells, then it is oxygenated blood. And when this oxygen is delivered to the targeted cells and the carbon dioxide are replaced, means carbon dioxide are attached to the hemoglobin, then it is called deoxygenated blood. In pictures you can see that 2 colors like this. This blue color indicate deoxygenated blood and the red color indicate oxygenated blood. Okay, that you have to understand. And what is the lifespan of this RBC? It is 120 days. Okay, and next is white blood cells, that is leukocyte. What do you mean by leuko? Leuko means white. Leuko means white and cyte means cell. Okay, cyte means cell. So white cells, white colored cells, that is called white blood cells, and these are 5 types. 5 types are there: neutrophils, lymphocytes, monocytes, eosinophils and basophils. Okay, this is the picture: monocyte, eosinophil, basophil, lymphocytes and neutrophils. They have very important role in the immune mechanism. Okay, they are also originate from where? Bone marrow. Okay, the blood cells and the white blood cells are originating from the bone marrow. And what are they doing in the immune system? They attacking the foreign bodies, antigens. What are the antigens? The materials or the other organisms which are attacking our immune system. Okay, like bacteria, virus, fungus, some chemicals, foreign substance, dust, all are the antigens to the attacking white blood cells. And what is the lifespan? 13 to 20 days are the lifespan. And platelets, okay, other name is thrombocytes. What do you mean by thrombo? Do you heard that name? Thrombo means clot. Clot is otherwise called thrombo. Cytes means cells, means these cells, the platelets, inducing clots. While we have any wounds, that after few minutes of blood flow, the blood flow will stop automatically. How? It's only because of these platelets, because at the wounded side the platelets will come and it's act like a network, and they will stop the RBCs in a trapped manner. They are like a mesh. They form like a mesh or a net, and they trap the coming RBC, so that after a few minutes the bleeding will stop automatically. It's only because of the platelets. Okay, these are the colorless cell fragments, and they have a very crucial role in blood clotting. Okay, the platelet count will be 1,50,000 to 4,000. No, not 1,50,000. Yes, 1,50,000 to 4 lakh actually. 4 lakh per microliter, and the lifespan is 8 to 10 days. Okay, and I already mentioned about plasma, that is the liquid component. 55% is blood plasma. The color is pale yellow or straw color, that I already mentioned just after the wound cutting off. After we have a wound, the white or the colorless fluid coming out of the wounded site is plasma. And this plasma have some other components like water, proteins, albumins. Proteins means the names of proteins are included here: albumins, globulins. Okay, albumin and globulins, and some clotting factors. And plasma where we can find some nutrients, hormones, waste products, some other chemicals also we can find in plasma, because it is the fluid part, that's why. Okay, and next so we talked about heart and blood, and next is about the blood vessels. The third component is blood vessel. Okay, here you can see that vein, and there is a branch produced from the vein, and that branch is called venule. In case of artery also, a branch is produced, and again subdivisions are happening, so that area is called arteriole. Okay, and there is a mesh, or there is a network between this venules and arteriole. This is called what actually it is called? Yes, capillaries. Okay, it is called capillaries. So that capillaries are very small connections, mesh like or a net like connections between the veins and arteries. Okay, you can see this kind of capillaries in every part of our body. And the arteries always carry oxygen rich blood, and the walls are elastic and high pressure. Why? Because while pumping, this oxygenated blood is going. Okay, so that's why it's have high pressure, and the walls are elastic, because they have to maintain that, they have to cope up with the high pressure. That's why the walls are elastic. And the largest artery is aorta. And vein carry what? Deoxygenated blood. That means carbon dioxide rich blood. Carbon dioxide rich blood. they have no that veins have not that much pressure. That's why the walls are thinner, and they have valves. Valves are for what purpose? To prevent the backflow. In case of I already told that there is um, valves between the chambers, atrium and ventricle. In both atrium and ventricle there is also tricuspid and bicuspid valve. In that case also uh, they the valves are for which purpose? For prevent the backflow. Okay, and next is capillary. That I already told that are the connections between arteries and veins. They are for exchange. What exchange? They are exchanging nutrients, oxygenated blood, deoxygenated blood, hormones, chemicals, waste materials. Okay, so they are mainly for exchange, and they are very small structure. Only one cell thickness are there, and almost our body have 1 lakh kilometer. Their length is almost 1 lakh kilometer throughout the body. Okay, next is circulation. So we talked about the heart, blood vessels. Okay, next we have two kind of circulation. We have two kind of circulation: pulmonary circulation and systemic circulation. Okay, pulmonary circulation and systemic circulation. Two circulations are there. So first we are going to consider pulmonary circulation. Pulmonary circulation, I already mentioned, pulmonary means lungs. So in this circulation, lungs are involved. That's why the name is pulmonary circulation. Okay, so here you can read the caption: blood strip to lungs. Okay, so the pathway, where it is start. Here I am going to write that this is right atrium, left atrium, right ventricle, left ventricle. Okay, so the pathway starts from where deoxygenated blood flows from right ventricle to lungs. Right ventricle to lungs through pulmonary artery. Here it goes to where? Lungs. So the blood flow from right atrium to right ventricle. So which blood is coming here? Oxygenated or deoxygenated? Deoxygenated. How? First you have to understand that here is superior vena cava is connected, and the inferior vena cava is connected to where? Right atrium. Okay, inferior vena cava collecting blood from the superior vena cava collect blood from the superior area. Superior area means the upper body part, like head, trunk, our hands, chest. So it collects the blood from the superior areas. This is superior vena cava, and this is inferior vena cava. It collects blood from lower part of the body, from abdomen, pelvic region, lower limbs, kidney. From these areas it collects blood to which blood? Deoxygenated blood, not just a blood, deoxygenated blood from lower part. So the right atrium always getting deoxygenated blood, that you should clear with. Okay, so the right atrium fills with deoxygenated blood. When it fills, it gives that blood to where? Right ventricle. From this right ventricle, which start pulmonary Yes, pulmonary arteries are starting and it gives this blood to where? Lungs. Okay, it gives to lungs. So what will happen? The lung exchange that carbon dioxide into oxygen. Okay, the oxygen refilling will happen there. Okay, this is actually happens in what? In pulmonary circulation, and that oxygenated blood again comes to where? From lungs. It is come to which area? Yes, left atrium. Left atrium. So what? Pulmonary vein. Pulmonary vein. Okay, so the blood, deoxygenated blood enter into right atrium from right ventricle through the pulmonary artery. It reach to lungs and the carbon dioxide are removed here and the oxygen is refilled. Again it will reach into the left atrium. Okay, from this till this it is called pulmonary circulation. From this again the left atrium filled with oxygenated blood. Now it is oxygenated. After coming from lungs it is oxygenated. When going to lungs it is deoxygenated. When coming from lungs it is oxygenated. Okay, it is oxygenated. The blood reaches left atrium, then it reaches left ventricle. From where what is starting? Aorta. Aorta is starting from this left ventricle and through the aorta blood will flow to the targeted areas, targeted cells. Okay, so till here it is, till this portion actually it is not that portion. One second. Left atrium, till this it is called what? Pulmonary circulation. This is pulmonary circulation. After that the blood reaches the targeted cells and again the blood is delivering oxygen and nutrients to the targeted areas and they will collect, the blood will collect the deoxygenated blood, means the carbon dioxide, and it become deoxygenated. Again it reach to where? Again it reach to where? Right atrium. Okay, right atrium. This area again from the left ventricle, from this left ventricle to right atrium, again it is systemic circulation. Till this it is pulmonary circulation. From here to here again systemic circulation, because the blood going to the systems. System means every organs, every system, and collect and giving the nutrients, giving oxygen and collecting all waste materials again to the right atrium. So it is systemic circulation. Okay, and in this case you have to understand this, and in this process some other things are happening. Other things means some phases are happening in cardiac cycle, that is called systole and diastole. you heard this words systole and diastole. Actually, I told that while we telling about heart, this this area, these ventricles are working more forcefully. This is right and this is left, working more forcefully when the muscle contracts. Muscle contracts means the muscle, that bottom portion will like this, bottom portion like this, and it contracts like this, contracts. So the blood will push into the pulmonary artery and aorta. So that phase is called systole. This area contracts. When this area contracts, it is called systole. That means blood pushing out of the ventricle into the aorta, into the pulmonary artery. It is called contraction. It is called systole. And the blood is flowing to aorta and pulmonary artery. Again, the heart is waiting for the filling of atriums, right atrium and right ventricle. The right atrium, right right atrium and left ventricle. Okay, right atrium and left atrium. It have to fill again. So after pushing, the heart is waiting for just a second to fill this right atrium and left atrium. So there happens a small relaxation. A relaxing phase is happening there. A small relaxation. In that time, this both chambers filling with blood. Okay, here what is filling? Here deoxygenated blood is filling. Here oxygenated blood is filling. So that fraction of second, there is relaxation happens. That relaxation is called diastole. That relaxation is called diastole. Okay, these are the two things you have to understand. Because of that systole and diastole, we can hear the sound like lub dub, lub dub. That sound we can hear while putting the stethoscope. Okay. So the normal blood pressure is what? 120/80 mm Hg. What is Hg? Hg is the mercury. Okay, why we using mercury? Because mercury have a constant density at any height, at any temperature. That's why we using mercury for a standard measurement in case of blood pressure. So the normal blood pressure is 120/80 mm Hg, and the systolic pressure is 120 mm Hg, and the diastolic pressure is 80 mm Hg. Why? Because the more pressure happens on the pumping. Pumping happens where? In the ventricle side, in the bottom portion, the ventricles. Okay, so there will be, the systole pressure will be high, that is 120 mm Hg, and the relaxing phase, that heart is waiting for filling the right atrium and left atrium. That phase, there is no much pressure. The heart is waiting for the filling of blood. So that fraction of second, that diastole is very low, that is 80 mm Hg. Okay, here I attached a picture so that you can understand, but you can go to YouTube, so you can get more good animation videos. Okay, next is some common circulatory problems. We all have, it's a common thing nowadays that majority people have the circulatory problem, especially who are above 40 or 45. Okay, so the common conditions normally because of the blood pressure. Okay, That means when blood pressure is high, we have lots of health issues like stroke uh, and brain hemorrhage. These are happening common right now because of the thinning of blood vessel walls. Okay, so uh, what happens in such cases? Because sometimes the blood flow is uh, somehow are are stopped, or it can be slowed by some of the clothes or um, some hindrances in the blood vessel. So such blockages or thrombos are called it's like thrombo means clots, are sometimes called plaque. So it's sometimes called plaque buildup. Plaque. This, because of that plaques, the blood will not flow very smoothly in a forwarded direction. Because of that, normally atherosclerosis can happen. And I already mentioned about inferior vena cava. If the inferior area means the lower portion of the blood vessels, lower portion of our body's blood vessels are not working properly, so that the swelling will happen in the lower limbs, especially in legs. Okay, so what happened? The varicose vein will start. It also associate with the improper functioning of heart valves. If the heart valves are not functioning properly, it is an indication that the heart is not proper, the valves are not proper. It indicates the varicose veins also. Okay, majority adults, especially the uh, males, have this kind of condition. And the heart attacks, or the normally we telling heart attack, otherwise it's a cardiac arrest. This also happens because of the long term chemical use, long term uh, use of liquor, long term use of nicotine. Okay, so we have to think about our heart. So what all things we can do? We can follow healthy diet, we can do proper exercise, we can avoid smoking, we can avoid we should, not we can, we should avoid smoking, we should avoid uh, uh, use the liquors. And uh, after an age, after 40-45 age, do proper checkups that whether our heart is working or not properly. And do if have any doubts, do ECG and do angiograms, so that we can get a clear picture. Okay, so and also one thing is that our happy hormones, if our hormones are working properly, so we can maintain a quality uh, mental health. So for that we have to learn to regulate our stress and strain, mental stress and strain. Okay, these are the main things that we can do. And for your knowledge, I just want to ask some random questions that I prepared uh, from the slides. Okay, what is the fluid part of blood? What is the fluid part of blood? Yes, plasma. The largest artery of body? Yes, aorta. And the erythrocytes are another term of what? Yes, RBC, red blood cells. The tricuspid valve located in between dash and dash. Tricuspid valve. Tricuspid valve. This is right atrium and right ventricle, left left atrium and left ventricle. So tricuspid valve are always in between. Yes. Okay, in between right atrium and right ventricle. Okay. The systole happens when the heart muscle is systole. Yes, when contraction happens, when the heart muscles contracts, the systole will happen. When the heart muscle is relaxing, diastole happens. Okay, that's about. If you have any doubts, you please to contact me. Okay, you can call or contact me. I will always there to clear the doubts. Okay, so thank you for your time. I will catch you next day the same time. Thank you for your cooperation. Take care. Goodbye.